What can we do to help you?
Stay home, please.
Leyate, I am so happy that you're able to join us today. We appreciate you, all the nurses, because you're an incredible nurse, but just big ups to all the nurses during this time, healthcare workers, essential workers. I mean, I know it's a very crazy, intense time, but we absolutely appreciate you so much. So just know that if I could say thank you a gazillion, bazillion times, I would. I appreciate you so much, not just me, but the entire world.
Appreciate that. Thank you.
Of course. So I want to talk a little bit about you during this time. Obviously, it is intense. It's chaotic, you being a nurse. Can you tell us a little bit about your educational background?
I studied public health and epidemiology in undergrad, and I have my master's in public health. And I just recently got my master's of science in nursing.
Yeah, so what made you want to become a nurse?
Well, I actually worked in healthcare for about 7 years on like the quality improvement side to increase patient safety. And I really wanted to get by the bedside and really provide that care directly to patients. And so nursing was just the profession I felt like I was called to do. I mean, with care and compassion and improving their health, I'm just really passionate about that. So that's why I went back to school.
What has been your experience during this pandemic?
You know, you try to be joyful and show up to work and, provide the best care you can for your patients. But it's a scary time not knowing when it will end. I think that as the US, sometimes we feel like we're distant from those type of diseases that affect a lot of other countries, but it's really hitting home now because it's affecting us. And I don't think we were really prepared for it. As we can tell, our healthcare system, it's hard to support something like this. It's nothing we could have ever imagined could happen.
You are a nurse, you're also a mom, you're also a wife. How are you balancing all of this? And are you getting the support that you need during this time?
It's difficult because we are a military family. So I don't have close family or friends nearby. The support I've been getting is like through phone and FaceTime and Zoom, and just trying to stay connected with people is the biggest way I've had support. I've had support with my coworkers, at my job in the hospital. So that's been the best way to get that support that I need.
How do you talk to your kids about this? For parents out there who are trying to explain what social distancing is and they might have a lot of questions, I'm sure they've been informed a lot because of schools closing. How can a parent simply explain this to young children?
We can't really use those big words with kids.
Right.
So we just say, I do tell her, coronavirus, there's a lot of germs out there for my 4-year-old. She said, I want to go see Nana and Pop. I want to go see, so-and-so. I want to go to school. I miss my friends. And I say, Hannah, there's a lot of people that are sick out there, and we want to make sure that you stay healthy and that people don't get sick. And there's tons of YouTube videos on like cute science cartoons that explain what that means. My 18-month-old, she just doesn't understand. So what I have to do with her, kids can pass germs so easily, and they wipe their nose so you just have to constantly clean surfaces all the time, disinfect.
Right.
So I can't really teach her stuff. I just kind of prevent stuff from spreading with her.
What is your routine when you go into the hospital?
So currently, I can't go straight to my unit. And so we go downstairs to get screened before we can even go.
Wow, really?
There's like little check marks. So you have to stay 6 feet apart when you go down the stairs. And then you go in, you have a survey, and you have to tell them, any symptoms that we're having. And then they give us our surgical mask for the day. And I sign off, and then I can go up to my unit. And the thing is, the hospitals are really good with hand hygiene. We have to scrub for like 2 minutes before we can even see a patient.
Wow.
That all stays the same. But the pre-screening process is definitely different.
Wow.
Are parents more worried and concerned during this time, having a baby because of COVID-19? Have there been different concerns about this?
The hard part I've heard are the restrictions with the visitors. Some places you can't have any visitors. Some places,
Right.
Places with more cases, they're not even allowing their spouses in the delivery room. So it's a sad time, because
Right.
you want to enjoy it. I think a lot of people are missing out on one of the most joyous times in their lives because of
Yeah.
Have you had access to protective N95 masks or surgical masks? I'm sure every place is different, totally. But have you been able to have access to that?
So yes, yes, I have surgical masks that we use one
Got it.
per shift. N95s, those are specifically for our COVID-19 rule outs.
Got it.
So I'm not sure of the supply, but I do know they are being very careful with the use of that and the reuse of that, sanitizing it so it can be used by that same person after a certain number of uses. But these policies are changing all the time depending on the demand. So there is a shortage everywhere. So our hospitals just do what they can to make sure that we can use them.
Before you go, how can we, regular day-to-day people, help nurses, healthcare workers, everyone who works at the hospital, whether it's housekeeping, just everybody? What can we do to help you?
Stay home, please. Let's, they said, even if we left the social distancing too early, we could be right back at the numbers that we're on now. So there's no such thing as, okay, it's over, So let's just be patient with one another and stay home. And I just want to say thank you for everyone for your support in doing that.
We love you, Leyate, and we're always cheering for you and all the other nurses, healthcare workers, everyone who's putting their life on the line every single day to take care of us. So we appreciate you, and say hi to the kids.
I will. Thank you, Nessa.
You're welcome. Love that amazing interview. And I want to hear from you. Like, comment, and subscribe to the Stoop channel so that you never miss out on the latest celebrity interviews.